And then what about the hangover? Multiple bariatric patients report that hangovers post-surgery are significantly worse than before. And there's actually a physiological reason for this. You are likely to be chronically dehydrated anyway. It's hard to get in enough water when you're also trying to get in protein and you can't drink with your meals. But alcohol is a diuretic. It will dehydrate you further. And dehydration post-bariatric surgery can be really serious. We're talking electrolyte imbalances, kidney issues, and those spectacular headaches that make you question all your life choices. So let's summarize what happens when you drink alcohol post-surgery. It absorbs faster, hits you harder, it peaks quicker, it hangs around longer, it dehydrates you more, and it comes with the side of potential dumping syndrome. And remember, this isn't your pre-surgery body anymore. And treating alcohol like it is, that's where the problems start. Now, I already mentioned that there is a risk of addiction. And we kind of need to talk about that elephant in the room. Alcohol addiction after bariatric surgery, and I know this might feel uncomfortable, but it's common. You might be thinking, I'm not an alcoholic, I don't have a drinking problem, this doesn't apply to me. And you might be right, but you also might not be. And the research shows that the people who develop problems often don't see it coming at all. There's a theory in bariatric research called addiction transfer or cross addiction. And it's a very real thing. The idea is this: before surgery, if you were using food to cope with stress, anxiety, boredom, or emotional pain, physical pain, well, the surgery removes that coping mechanism immediately. You physically, once you come out of surgery, cannot eat the way you used to. But the underlying emotional issues, they don't get surgically removed. So some patients, not all of us, but some of us, transfer that addictive behavior to something else. Could be shopping, could be gambling, could be exercise, could even be relationships. But more often than not, it's alcohol. Research has shown that before surgery, about 7.6 met the criteria for alcohol addiction. 1 year after surgery, that dropped only a little bit, but down to 7.3%. But then it started climbing. 2 years post-op, 9.6%. By year 5, 10.7%. And the highest risk group, like I said, gastric bypass patients, particularly men who were younger at the time of surgery. Here's another piece of interesting research which has been published in Obesity Surgery Journal. It explored changes in brain chemistry after bariatric surgery. Weight loss alters dopamine signaling. That's the reward chemical. That's the thing that you feel gives you the credit for something you like. Before surgery, eating certain foods triggered that dopamine release. But after surgery, eating doesn't provide that same reward because your brain is essentially experiencing reward deficiency.